Well, there's basically three main approaches to the hip. There's the anterior approach or the front approach. There's the lateral approach or the side approach, and then there's the posterior approach or the back approach. I'll first just describe the front and side approach quickly. Um, Both the front and side approaches have longer incisions, and the incision's important because of cosmetics, but the most important aspect of the front and side approach is that you cut muscle, and you're cutting tissue that increases pain, increases impairment, increases your recovery time, and increases the restrictions that a patient will have after surgery while they heal and recover from the cut muscle. And so they'll have a limp for a longer period of time. They'll have positional restrictions where they can't place their hip in certain positions because of the increased risk of dislocation. So they'll have to have built up seats, raised toilet seats. They can't put on their socks normally. They have to have others help them dress for 6 to 8 weeks. So that's a fair amount of time. And that's quite a process of recovery from, say, the more traditional approach. Now, the anterior approach is different because we go through the front. This incision is about a third of the size. And again, it's not the incision that's as important. Yes, the cosmetic is appealing because instead of a 8-inch incision or 10-inch incision, it's a 3 to 3.5-inch incision. But it's the deeper approach that's important. So we're not cutting muscle, we're going between the muscle, which is why it's often called the muscle sparing approach. We don't cut muscle, we spare the muscle. So instead of cutting the muscle, we go between the muscles of the hip to access the hip, and the recovery afterwards is much better. They don't have the pain from having to heal from cut muscle. They don't have the restrictions. They don't have the limp. And so you find that after surgery, they are walking without a limp, without the restrictions, decreased rate of dislocation, far faster recovery than a traditional hip. To give you an example, a typical hospitalization after a regular hip replacement is 3 to 5 days. A typical hospital stay after anterior hip is 1 night in the hospital. Many patients are out walking a few hours after their surgery and amazed at how better they feel. Yes, they're suffering from the pain of surgery, but oftentimes the pain from the arthritis was so severe that immediately they feel so much better from having that relief without the arthritic pain that they were suffering from. So I just found that the anterior approach allows me to have better, faster results when compared to the traditional approach. If you compared patient A who had the anterior approach and patient B with the traditional approach, at 6 months I would find that they're pretty comparable. But the patient B will tell you, boy, those first several months was rough. I had to go through the precautions and restrictions and the pain and the limp. And you'll compare the anterior approach, who didn't have as much pain, didn't have the limp, was walking unassisted, back to work in 2 weeks, back in the golf course in 2 weeks. That's a life changer. That's a difference maker. I'm finding more and more patients in the area here in Delaware are not familiar with the anterior approach. And the ones that are going to Philadelphia or Baltimore. And my goal is to let them know that there's an experienced anterior hip surgeon right here locally in your backyard that will provide good care. We have excellent facility here at Bayhealth, and in the process of developing a joint center of excellence. I think that they'll be happy with the care that they've received here.